the vast majority of patients, they don't really know that they have chronic kidney disease. So they end up in the hospital saying, hey doc, I feel like crap, something's wrong. They realize that they ultimately have end-stage renal disease and they need immediate dialysis to sustain their life. They get what's called a central venous catheter placed into their neck. Even though these catheters are only supposed to be in the neck for a couple weeks, in the United States, if you look at the USRDS database, the average time that these patients are reliant on these catheters is 7 months. And we were really shocked to learn that. We were trying to figure out, well, why does it take so long? And what we found is vascular remodeling that happens in the first few weeks. Why are the catheters in for so long? And what we learned is in order to determine when the fistula is ready for use, or in a negative scenario where the patient requires an intervention or the fistula has failed and needs to be replaced, ideally you get an ultrasound that tells you three things. First, what's the flow rate through that fistula? Second, what's the diameter of the fistula? Is it actually big enough to get a needle into it? And then third, what's the depth from the fistula? Is it actually reasonable to expect a dialysis tech to be able to get a needle into the fistula reliably? So what we decided to do is create this two-part technology that we call EchoMark and EchoSure to enable these dialysis technicians to get an ultrasound that's comparable to a trained sonographer in a vascular lab doing a conventional ultrasound. So the way that works is there's a little device called EchoMark that's placed underneath the fistula at the time of surgery that is made with this novel manufacturing technique that's highly echogenic or ultrasound visible. And it works with our companion device called EchoSure, which is a 3D AI-enabled ultrasound podcast for anyone in a dialysis clinic to be able to put our probe on the arm, click a button, and capture the data that's necessary to manage these patients. And we simplified the ability to get this ultrasound to a layperson so that we can expand access and really meet the patient where they are to deliver the best care as early as possible to get these catheters out sooner.
I imagine even like the vascular remodeling due to the diabetes is impacted too, right? So like they really need all the help they can get. So whenever I was reading through, what you guys are doing, it made me think of, the plate that they put behind the x-ray, right? Whenever you've ever gotten like broken your wrist or something, right? They set it on the plate so the x-ray can get better visualization. Obviously different tech, but it seems like that's kind of a similar principle.